Hey guys, welcome to another video. Today our topic is on fatty liver disease. So let's get started. So fatty liver disease is a condition in which excess fat accumulates in liver cells. There are two main types of fatty liver disease: alcoholic fatty liver disease, which is caused by excessive alcohol consumption, and non-alcoholic fatty liver disease, which is not related to alcohol consumption. Non-alcoholic fatty liver disease is actually the most common form of fatty liver disease, and it can be further divided into two subtypes: simple fatty liver, which is the accumulation of fat in the liver without any inflammation or damage to the liver cells, and non-alcoholic steatohepatitis, which is a more severe form of the disease that involves inflammation and damage to liver cells. The exact cause of non-alcoholic fatty liver disease is not fully understood, but it is believed to be related to insulin resistance, metabolic syndrome, and obesity. People who are overweight or obese, have type 2 diabetes, high blood pressure, or high cholesterol are at a higher risk of developing non-alcoholic fatty liver disease. In the early stages, fatty liver disease often does not cause any symptoms, but as the disease progresses, some people may experience fatigue, abdominal discomfort, and yellowing of the skin and eyes, or jaundice. If left untreated, fatty liver disease can lead to more serious liver conditions such as cirrhosis and liver cancer. Now, there is no specific medication or treatment to cure fatty liver disease, but lifestyle changes such as weight loss, exercise, and a healthy diet can help manage the condition. In addition, avoiding alcohol and certain medications is important in managing alcoholic fatty liver disease. Regular monitoring by a healthcare provider is important in preventing and managing fatty liver disease and its potential complications. Alcoholic fatty liver disease is caused by excessive alcohol consumption, which can lead to a buildup of fat in the liver. The liver is responsible for processing alcohol, and when it is overloaded with alcohol, it can't process it all, so the excess alcohol is converted into fat and stored in the liver cells. Non-alcoholic liver disease is not related to alcohol consumption and can be caused by various factors, including obesity, insulin resistance, and metabolic syndrome. Insulin resistance is a condition in which the body cells become resistant to the effects of insulin. Insulin, as we all know, is a hormone that helps regulate blood sugar levels. This can lead to an increase in the amount of glucose and fatty acids in the blood, which can contribute to the development of non-alcoholic fatty liver disease. Metabolic syndrome is a group of conditions that increase the risk of developing heart diseases, stroke, and type 2 diabetes. It includes obesity, high blood pressure, high blood sugar levels, and high levels of cholesterol and triglycerides in the blood. People with metabolic syndrome are at a higher risk of developing non-alcoholic fatty liver disease. Obesity is also a major risk factor for NAFLD. Excess weight, particularly in the abdominal area, can lead to insulin resistance, and the liver may start to accumulate excess fat. Overall, the causes of fatty liver disease depend on the type of fatty liver disease. Alcoholic fatty liver disease is caused by excessive alcohol consumption, whereas non-alcoholic disease is caused by various factors such as obesity, insulin resistance, and high levels of triglycerides in the blood. Fatty liver disease often doesn't cause any symptoms in the early stages, which is why it is often diagnosed incidentally during routine medical checkups or tests. However, as the disease progresses, some people may experience symptoms such as fatigue, weakness, abdominal discomfort, and yellowing of the skin and eyes. In terms of diagnosis, blood tests can be used to assess liver function and identify any abnormalities such as elevated levels of liver enzymes. Imaging tests such as ultrasound, CT scan, or an MRI can also be used to detect the presence of fat in the liver and assess the extent of liver damage. These tests can also help distinguish between simple fatty liver and non-alcoholic steatohepatitis, which is a more severe form of fatty liver disease. In some cases, a liver biopsy may also be performed to confirm the diagnosis and assess the degree of liver damage. During a liver biopsy, a small sample of liver tissue will be removed and examined under a microscope. It is important to note that not everyone with fatty liver disease will develop symptoms, and some people may not have any abnormalities on blood tests or imaging tests. Regular monitoring by a healthcare provider is important in detecting and managing fatty liver disease and its potential complications. As of today, there is currently no specific medication or treatment to cure fatty liver disease, but lifestyle changes can help manage the condition and may help reverse the damage in some cases. Here are some strategies. First is weight loss. Losing weight, especially around the abdominal area, can help reduce the amount of fat in the liver. A weight loss of 5 to 10% of body weight can improve liver function and reduce the risk of complications. Regular exercise can help improve insulin sensitivity and reduce the amount of fat in the liver. Aim for at least 30 minutes of moderate intensity exercise, such as brisk walking, on most days of the week. Third is having a healthy diet. A healthy diet can help reduce the amount of fat in the liver and improve overall health. Focus on a diet that is high in fruits, vegetables, whole grains, and protein, and low in saturated and trans fats, added sugars, and refined carbohydrates. Avoiding alcohol. If you have alcoholic fatty liver disease, avoiding alcohol is essential. Even moderate alcohol consumption can worsen the condition and increase the risk of liver damage. Avoiding certain medications. Some medications can be harmful to the liver, especially if you have a liver disease. So talk to your healthcare provider about any medications you are taking and whether they are safe for your liver or not. It is important to work with a healthcare provider or a physician to develop a personalized plan for managing fatty liver disease. In some cases, medications may be prescribed to manage underlying conditions such as high cholesterol or diabetes. Regular monitoring is important to assess liver function and detect any potential complications. Fatty liver disease can progress to more serious liver conditions such as cirrhosis or even liver cancer. Here are some information on these potential complications and the importance of prevention and management. First is cirrhosis. Cirrhosis is a condition in which the liver becomes scarred and damaged, leading to impaired liver function. Fatty liver disease is one of the leading causes of cirrhosis. Symptoms of cirrhosis can include fatigue, weakness, abdominal pain, and jaundice. In severe cases, liver transplant may be necessary. Fatty liver disease, especially non-alcoholic steatohepatitis, is also a risk factor for liver cancer. Symptoms of liver cancer can include abdominal pain, weight loss, and jaundice. Early detection and treatment of liver cancer can improve outcomes. Prevention and management of fatty liver disease are important to reduce the risk of these complications. Healthy habits such as regular exercise, a healthy diet, and avoiding alcohol can help reduce the risk of fatty liver disease. It is also important to manage underlying conditions such as obesity, high cholesterol, and diabetes. Regular monitoring by a physician is important to detect and manage fatty liver disease and its potential complications. Blood tests and imaging tests can be used to monitor liver function and assess the progression of the diseases in some cases. In some cases, medications can be prescribed to manage underlying conditions such as high cholesterol or diabetes. Overall, prevention and management of fatty liver disease are important to reduce the risk of the serious liver conditions such as cirrhosis and liver cancer. Healthy habits and regular monitoring by a healthcare provider can help manage the condition and reduce the risk of complications.